Very often, people are not aware of the connection between weight and diabetes. When they ask you, how can I prevent or delay diabetes? And the answer is very simple. If you eat healthy, if you exercise regularly, and keep your weight at the target, which means a BMI of not more than 23 for Indians, and if you're overweight, try and reduce weight to reach that level by healthy strategies, you will be able to delay or even avoid diabetes to a large degree. Even in those who have family history, diabetes can be delayed very significantly simply by maintaining ideal body weight. Linked to this is the question about reversal of diabetes. Can lifestyle reverse diabetes? Yes, it can, but not in everybody. In people with recent onset of diabetes, maybe 5 years, some studies have shown up to 10 years, younger patients, those who are overweight or obese when they get diabetes, if they take strict measures, again, lifestyle measures like diet and exercise to lose weight, they will reverse diabetes very often. But this has to be done at the right time, with the right strategy. There is no magic in diabetes reversal. Weight loss to reach an ideal body weight along with regular exercise can reverse in young patients with recent onset diabetes. It can reverse diabetes. So I think this is important. It's actually remission, not reversal, because we don't know when the diabetes will really come back or whether it will come back. The diabetes is a progressive condition, it doesn't really go away. So it's better to call it remission rather than reversal. One mistake that people often make is about their medication, because they feel if your numbers are okay, if your sugar level is okay, your HbA1c is okay, your blood pressure, cholesterol is okay, you're good with just lifestyle. But if they are not, you need medication. And if you are on medication for diabetes, do not stop the medication because the numbers have become normal. Whatever is required to keep the numbers normal, the blood glucose normal, is the medication that you require. So never stop the diabetes medicine without checking with your doctor.
It has been very well known for many decades now that Indians are more prone to type 2 diabetes. We have what is called as the Asian Indian phenotype, which makes us more prone to diabetes. In other words, whereas in the West, most people get diabetes when they are 50, 60 years old, we tend to get it when we are 20, 30 years old, and often even younger. Even adolescents can get type 2 diabetes. The exact reason for this is not known, but definitely one of the contributors is the very high carbohydrate diet that we take. We have shown that when people consume too much of rice, this gets converted into glucose, and this drains out all the insulin from the pancreas, making us more vulnerable and susceptible to type 2 diabetes. Indians also do not exercise enough, and this could be yet another reason. There could be genetic factors as well. The most important complications of diabetes that you can get are those that affect the kidney, the eyes, the heart, the feet, and the nerves. The good news is that all these complications, which can occur both in type 1 diabetes as well as in type 2 diabetes, can be prevented by good control of diabetes. We call it as the ABC formula. A stands for A1C or HbA1c. This must be kept below 7% or even lower. The blood pressure must be kept under control, at least below 140/90, and that's what we call as B. And C, of course, stands for cholesterol. The LDL cholesterol or the bad cholesterol should be kept below 100 milligram per deciliter. So if we keep this A, B, C under control and have some form of D also. D, for example, stands for discipline, which includes diet, exercise, sleeping on time, doing yoga, meditation, relaxation. If you just follow a healthy lifestyle and take your medicines regularly, visit your doctor regularly, then you can have a long and healthy life. We have shown that people with diabetes can live even up to 95 or 100 years of age without any complications, provided this A, B, C, and D are kept under control.
As we all know, diabetes is a very common disorder, and it's increasing, its prevalence is increasing all over the world, but more so in India. Now, Indians are extremely prone to develop diabetes. And why is it so? Because of many factors. One is that there is an inherent genetic predisposition. So even Indians living in other countries have a higher risk of diabetes compared to the native population. So there is something inherent in us which makes us more prone to diabetes. But that's not all. Our diet, which is usually higher in carbohydrate, less in protein, that is also something which predisposes to develop diabetes. Also, many Indians, many of us do not exercise regularly, and that makes us prone to develop diabetes. So all these factors make us more prone to develop diabetes. But apart from diet and exercise, it's very important that you take medication if required. Medication is something which prevents the complications, which controls your sugars, and there are excellent medications available for diabetes these days. What you need to understand is that the medicine needs to be taken regularly, and also it needs to be regulated. The dose needs to be regulated. So sugars need to be monitored, and the doses of medications need to be adhered to and to be regulated periodically by your physician or doctor you are consulting. If you do that, you can achieve a good control and maintain it like that. There's a lot of talk about reversal of diabetes, if you have seen recently. Now, essentially that means is that you have diabetes, you manage it very well, and after some time the medicine is stopped and your sugars are absolutely normal. But does that happen? Can that happen? Yes, it can happen in some people. We don't want to call it a reversal, we call it a remission. Diabetes has been treated. Now the only way to achieve so-called reversal is also to control the sugars very strictly soon after diagnosis. So if you control sugars very strictly soon after diagnosis, there are chances that your diabetes may get controlled and you may go into reversal or so-called remission.
Diabetes produces long-term complications which are either acute or chronic. But the chronic complications are particularly affecting the blood vessels of the heart, brain and peripheral limbs. It can lead to heart attacks, stroke and gangrene. So this can be avoided if you control your diabetes well. Look at the warning signals such as burning of the feet, non-healing ulcers on the lower limbs, mild chest discomfort on exertion, giddiness and some neurological abnormalities that you face, which may be a lack of words while talking or speech defects or difficulty in making movements with the hands. Any of these symptoms, you have to be careful and investigate, and you see that you do not have the complications related to heart such as myocardial infarctions, congestive cardiac failure or stroke or atrial fibrillation. That's the way you can avoid getting these complications. Control of sugar should be absolutely proper. Your diet should be adequate but should not have too many fats. You should have healthy fats and you should exercise regularly. The three cardinal features that a diabetic should always remember. One is you should sleep at least 8 hours. You should do adequate exercise and become physically active and restrict the calories as well as fat in your diet and try to remain happy. Then you will avoid most of the complications.
I want to tell you that patients who have family history of diabetes and who are at the risk of developing diabetes because of obesity or who have other risk factors like cholesterol and blood pressure, it's important that we have a low carbohydrate diet, high sugary diet, high fat diet to be avoided, junk food to be avoided. Regular exercise is very important, which involves your cardio workout, that's your regular walking 30 to 40 minutes per day, as well as some muscle strengthening exercises because muscles helps to reduce, takes up glucose and helps to reduce insulin resistance. Patients who have diabetes, remember that diabetes to look at as a multisystem disease. It can cause eye damage, it can cause heart attacks, it can cause kidney problems. The idea is to see which organ is affected how much and how to prevent it from further damage.